It's all about mobility. The Center for Hip Health and Mobility is on the move. The Mobile Lab is a research facility that will be visiting communities throughout British Columbia. Working with healthcare professionals, the lab will gather information and data that will play a vital role in improving hip health.
This is a fantastic addition in the sense that the Center for Hip Health and Mobility Mobile Lab actually gives us the opportunity to actually look at recovery, for example, after hip fracture, or even just look at people's physical activity levels around the province. So certainly what this will help us do is to actually connect with communities outside of Vancouver.
It's an important component in the fight to reduce the more than 3,000 hip replacement operations and over 4,000 hip fractures in BC a year, and the number is rising.
There's going to be an increase in the number of hip fractures, mostly because there's an increase because of the boomers.
The Center for Hip Health and Mobility was created in 2006 to detect, prevent, and treat bone and joint problems associated with bone and joint disease. Naturally, a considerable amount of energy is focused on those over 65, in particular, their mobility.
We know that folks who are more physically active, seniors who are more physically active, have stronger muscles, they fall less, and when they fall, they have stronger bones and are less likely to fracture.
The research the Centre is conducting in Vancouver and throughout British Columbia is building a library of information that is already playing a role in the design of active prevention programs.
And mobility is for everyone, and you really can make a huge difference with small amounts of activity. Vicky, I think the Olympian connotation makes people think of lots of hours of training, but in fact 30 minutes of accumulated physical activity, so that's just 3 10-minute walks in a day, makes an enormous difference to a range of health elements.
The Centre is committed to prevent falls and fractures from occurring, to detect arthritis earlier than has previously been possible, and to treat individuals with innovative surgical techniques so as to preserve, restore, and enhance mobility.
The vision is for us to make a little bit difference and enhance mobility of individuals across the lifespan in BC and hopefully beyond BC.
The number of people with osteoarthritis is predicted to grow by an astonishing 124% by 2031. The percentage of joint replacement operations in the population is expected to stay the same, but because the number of people living longer, the number of hip replacement operations is expected to grow by 30% over the next 20 years.
The average age of hip fracture is 81, and hip fracture kills 20% of people who have it. And it's a frightening statistic because these are people who may be community dwelling, grandparents of ours who are functioning very well. And 80 is not old these days. That can be 10 or 15 more years of very good quality of life. And yet the hip fracture can kill that person.
The facts are, the two main causes of bone and joint disease and injury are osteoarthritis and falls related to hip fractures. Arthritis is among the top 3 most common chronic illnesses in Canada, and its estimated direct costs are $4.4 billion each year. In BC, falls among seniors account for 4,000 hip fractures and 1,000 deaths. 20% of people who suffer a hip fracture die within 1 year, and 50% of seniors never regain proper hip function. The direct hospital cost of a hip fracture is $18,000, with an average annual hospital cost of $75 million to the healthcare system.
There's a quote that one of the falls research participants said, that it was an older woman who said, "The moment I hit the ground, I knew that my life had changed forever." And it's absolutely true. I mean, they don't go back home often after fall, and often they're in institutional care after that.
The Centre for Hip Health in Vancouver and the Mobile Lab on the road around British Columbia were created to make a difference. For further information about the Centre for Hip Health and Mobility, or information on how you can participate in a research study, please visit our website at www.hiphealth.ca.